Welcome back to the Pump YouTube channel. In today's very special episode, the Pump team got the chance to meet up with Dr. Hassan Moghadam, a world-renowned oral maxillofacial surgeon, to see what he's up to on a day-to-day basis, from cases to work around his office. So buckle up and get ready for a day in the life of an oral maxillofacial surgeon, brought to you by Pump.
I'm going to walk you through our sterilization center. Come on in through here. This is our central sterilization where all the stuff is sterilized, cleaned. You have a dirty side, you have a clean side. Come on over. So a little prep there with the scrub, and then just come in for a second. And then this is our operating room. So this is where, come on in. There's our anesthesia. And then so patients are brought in, we have all this stuff's here, and then they come into recovery. Straight to the recovery room. And then we usually have recovery roomers. Diana, hello, how are you? Good, good. And then out they go that way, so if you're doing cosmetic surgery, nobody ever sees them. I designed this in 2006, I built this building, and what we want to do is make sure that people come in privately from the front and then completely leave out the back where their ride's there, so nobody ever sees them coming in and out. That's it. Alright. So this is a little interesting case. He has Behçet's muscular dystrophy. He also has a history of epilepsy. So we cannot use a trigger because we treated him like he had malignant hyperthermia. So we could not use the triggers. One of the triggers in the general anesthetic is the anesthetic gas, sevoflurane, isoflurane. Many of those gases are a trigger for MH, malignant hyperthermia, which in the old days people used to die from, because it's basically the cytoplasmic reticulum of a muscle, which you probably studied in school. When you release calcium, the actin and myosin fibers contract to pull the muscle, right? So their cytoplasmic reticulum cannot reuptake the calcium, so it dumps the calcium out for the contraction, and then it keeps contracting, and it cannot stop. So they go into these triggers, and then it builds up heat. It's called malignant hyperthermia. But the first sign of MH is increased CO2. So the CO2 goes up, and then in the old days they would die because you couldn't stop. They go into kidney failure because imagine constantly contracting your muscle without stopping. So your whole body would do that. So then they figured out that's what it was, and so we don't use the trigger. So he had a TVO, total intravenous anesthetic, and he just had his wisdom teeth out. But because of his special medical condition, we have our anesthesiologist from the Ottawa Hospital that do it here, and we're very cautious. So he could have been fine if we gave him a general anesthetic with it. It's a risk is super low with that syndrome, but we're just extra cautious. And the technology today, they did a virtual consult with his mother and him in his home, and so anesthesia could do the consultation, get all the history, and then they met him today for the anesthetic. So it's a pretty cool thing. Here today to take out all your upper teeth, and usually that's kind of a difficult, traumatic experience for a lot of patients, because and you're very young to have this done. So tell me how you feel about going into the surgery.
I'm excited. I can't wait to get them all removed.
Really?
Yeah.
Were you having a lot of pain?
I was having pain. They were bleeding and everything, the uppers.
Yes. And what led you to this point? Like, how did it get to the point where you...
I went to a dentist, and then we were going to fix them at first, but then I'm like, you know what? I need them removed. I wanted them removed. I've been wanting them removed for a long time.
And you've had a lot of pain and all that, so you're just happy to get it done, get out of pain.
Yes.
And how long have you waited for this appointment?
Probably good, almost 15 years.
15 years to get to this point?
Yep.
So what happens is that when you take your teeth out of one upper jaw, you have little sharp edges in the bone, and we're going to file down, and then it's slowly sharpen. That's why they wait 6 weeks minimum, because the bone has to shrink and remodel and restore and smoothen out. It'll take about a year for everything to go smooth. So just be patient, okay?
Yep, absolutely.
Perfect. You're such a nice patient. Love it. And like that, and when you take these two teeth together, you can put a big hole in the sinus. And the sinus floor is really low, so all you have is bone from here to here. So when you go to take when you take two teeth together, the bone comes with it, leaves a hole, and then it becomes a disaster. So basically what we're going to do is take these teeth out very carefully and slowly, expand the bone and section the roots, take them out individual roots, so you don't put a hole in the sinus. Yeah. Alright, so this is called alveoplasty. You ready? I'm going to just show you. So this was 2013.
Yep.
And then 2020. So something's going on. Hopefully it's just a cyst, and that's usually what it is. Sometimes it's a very benign tumor we have to deal with. Now, the most important thing we talked about is your nerve.
Yeah.
You remember that?
Yes.
What did I say about your nerve?
We could do like
Yeah. So your nerve
my left.
goes right through here, and it goes here. So when we take this out, we're going to try to scoop the cyst out. See if we can get this out. Sometimes we cut this into little pieces. This is at the bottom of your jaw, so I have to get in and get to the bottom. And then the nerve is in here. So sometimes the nerve gets compressed during the procedure, and that's fine. If the nerve gets compressed, your numbness will come back. You'll have numbness. You're 99% chance of you will have numbness after today, but that's normal from just compressing on. There's a chance that it'll be permanent.
Yep.
So what that means is your lower lip from here to here will have tingling numbness, but then eventually, I have patients who have it from jaw surgery, they break their jaw, and they just, when you touch it, it feels a little different than the other side. Nothing to do with movement or speech. That's a nerve in your neck for movement. That's not the facial.
Okay.
So this is the cyst here, and what we're doing is, you saw, this is the tooth here, and this is the nerve. So the nerve and the teeth are very close together, and as we go, you see more of the tooth here. They're not intertwined, which is good. There's the nerve there, and this is the danger. You see, ooh, okay, we gotta do this. The danger is right here. There's one root on one side, and the nerve is in the middle. So if I go to pull this without cutting it, I'm gonna rip the nerve, okay? So this is the most important thing. If you don't review this, you're gonna get in trouble. I'm just gonna take a picture of this for documentation. Okay. So you understand what I'm saying? You got a root on either side, you got the nerve in the middle. If you pull, you're gonna rip it. So you have to cut this into pieces to get it out. Emotional support pickle. I will always be around toilet you to know that you are a big deal. I will always be around to let you know that you are a big deal. So I have dyslexia. You guys hear that? I cannot read and I cannot write. And that's why I need this emotional support. We're gonna make it. Okay, Kayla, Persian tea. I'm gonna start doing my crushing of my cardamom.
Oh my god. Are we filming this?
You know, when I open my shop, my tea shop, it's gonna be Moghadam's Minty Tea. MMT.
Remember that.
I'm gonna be MMT. That's gonna be the name of my new place. All right. Okay. First important teapot. Smell. It smells so good, right? Then we bring cardamom. Then we have orange blossom from a orange tree in Iran. Then we have Earl Grey tea. It smells so good. And then we gotta do crushing. Okay. And then crush the hell out of this thing. Then we put it in here. Then we put this. And tea. Alright. So we put a couple of scoops. And that's it. So you gotta have fun at work, right? Otherwise, you'll be depressed and you hate your job. You gotta have fun. It's not just a job, right? It's not just the surgery. It's not like you gotta have fun with the staff. It's your attitude. You gotta be positive. And you see how I talk to the patient? You gotta care about the patient. It's really important that the patient feels that you're out there taking care of them and doing the best you can. When you're in practice 20 years, you learn how to communicate with these patients and how to explain things and have their expectations properly. Is the patient ready? Can you put a long 702 on there, please? Damn, that's good. Let's go. See in here? This is all infected. This swelling, you see here? And then this is loose. I don't want to hurt it, but this whole thing is loose, okay? So it's got an infection that's gone up underneath his, and take this up underneath his eyeball. If this kept going, it would get into the eye. Go into his neck and he could die from a neck infection. So it's much better that it's in the upper tube. And sometimes you don't see these things until there's, you get that sweater. You'll feel a little bit of pressure, okay? We're gonna test everything. This is okay. This means you're frozen, okay? If I can do this is how we test. If I can do this and you don't feel pain, that means you're frozen. See, I can do that. Beautiful. All right, so just hang in there. 1, 2, 3.
You'll feel a little bit of pressure, okay?
Just give me a second. Done. Oh, okay. Bring this up right there. Drain it a little bit. So it's early stages, which is good. If the infection isn't gotten hard or big yet. Alright, I'm there. Is everything good there?